students' emergency seizure medication could come to school in different forms. It could come in a vial with a syringe and a needle and a nasal adapter for the medication to be administered in their nostrils. Or the student's medication could come in a glass vial with a dropper for the medication to be administered buccally or inside their cheek. Additionally, their medication could come in a plastic bottle with an oral syringe for the medication to be administered inside their cheek as well. Or their medication could come in a pre-filled syringe to be administered inside their cheek. It is important for you to discuss this with the school nurse or the student's healthcare provider so that you understand how the medication should be administered.
Given that when a child is having a seizure, it can be a stressful situation, it is highly recommended that you familiarize yourself with that child's seizure emergency care plan beforehand. Store the seizure emergency plan in a location that is easily accessible during a seizure. Be sure to check expiration date on the medication bottle or package. Call for assistance if someone else is present. Place the child on a flat surface, such as the floor, being sure not to move the child any more than is necessary. Turn the child onto their side to allow vomit or phlegm to be expelled rather than inhaled. Place something soft under the child's head to protect them from injury. Ensure the child's airway is not obstructed. Loosen tight clothing around the child's neck. Do not restrict the child's arms or legs. Ensure there is no furniture or objects close to the child that could injure them. Review the child's seizure emergency action plan. Gather the emergency medication and needed supplies in case the seizure lasts longer than the designated time frame. If possible, wash your hands. Assemble the needed supplies. Put on gloves. Check the bottle of medication to ensure that it is, for the right child, the right medication, the right dose, being given at the right time, being given by the right route, and not expired. Ensure the appropriate amount of time has passed prior to administering the student's seizure medication. If there is another adult present, have them call 911 or EMS as you administer the medication. Twist or place the needle onto the syringe. Remove the cap from the vial of medication. Insert the needle into the vial and withdraw prescribed amount of medication. Pull the needle and syringe out of the vial and verify the dose of the medication. Twist off or remove the syringe from the needle. Attach the atomizer tip to the syringe and twist into place. Discard the needle into a sharps container. Look into the child's nostrils to determine if there is fluid or mucus in the nostrils. If drainage or mucus is present, use a bulb syringe to remove it. Using your free hand to hold the crown of the head stable, place the tip of the atomizer snugly against the nostril, aiming slightly up and outward. Quickly compress the syringe plunger to deliver half of the medication into the nostril. Move the device over to the opposite nostril and administer the remaining medication into that nostril. The child may grimace or appear more restless momentarily after the medication is given. Remove gloves. If 911 has not been called yet, call 911 or EMS services. Stay with the child, monitoring breathing. If breathing stops, begin rescue breaths. If breathing and heartbeat stop, begin CPR. Once rescue squad arrives, inform them of medication administered, including type of medication, dose, and time. Remember to dispose of all used equipment and bottles of medicine safely out of the reach of children. Wash hands. Document the date, time, and dose of medication given, in addition to what was observed during the seizure. Follow up with the parent or guardian and healthcare provider as needed.